Like Meg from Family Guy, the upper arm can often be neglected, at least in terms of rollout spots. And that is an issue because the upper arm has some really amazing areas that you sometimes have to hit to get that full relief in the arm and shoulder. When it comes to the upper arm, we're all familiar with the bicep and tricep, but we will also be addressing today what we call the inside and outside middle line. This is connective tissue that actually connects muscles from the trunk to the forearm. Also worth noting is that the upper arm houses tissues that are really in the middle of the muscle chains that travel the trunk to the end of the hand. So you'll rarely start by just going straight to the upper arm. You're usually going to want to start either in the hands or the pecs and work your way into the upper arm tissues. Okay, starting with the outer arm, we're going to be hitting the deltoid first, which is a triangular shaped muscle that has fibers running three-dimensionally all the way around the shoulder. So you're going to want to hit them from every angle, and it connects, the deltoid attaches right here in the arm and comes down fascially into a bit of connective tissue that we call the outside middle line. So let's get into it. We call it the middle line because that line of connective tissue runs between the bicep and tricep. And it's not a muscle, it's connective tissue, but it can get tight when the muscles at either end of it are tight for too long. So again, with the deltoid, you're going to want to hit from all the different angles. So from the back, middle, and front, see which ones you need the most. And when it comes to that middle line, you're just going to basically bring the ball a little bit further down, and you can go straight on, sinking in slowly. And as it opens up, you can again lean side to side. As you lean to the side, if you lean to the back, you're going to get more tricep. And as you lean to the front, you'll start coming into either the bicep. If you're lower down, another muscle under the bicep. But you're just feeling that out. Bring that all the way down. As we get to the bottom of the arm, you have the big muscle here on top of the forearm. It actually attaches right here. So you can get a lot of good release. So really, right at this 45-degree angle coming in at the bottom, you want to lean in. And for this, it's sometimes nicer to have your palm face up or facing to the wall and then to just lean in, getting it like this. And that's pretty intense for me right there. Or sometimes you need a bigger ball. So you can grab a softball, and that makes it a little bit easier to get into this with your arm extended coming in like this. And here you can have your palm on it. You might have your thumb facing it, but you can just kind of go slowly into that area. All right, next up is the back of the arm, the tricep. The tricep is three-dimensional like all muscles, so you're going to want to hit it from the middle, the outside, the inside. Remember that as I'm showing you these techniques. I'm going to give you a couple options. We'll use a softball, a club bell, even the back of a chair. So without further ado, let's get into it. With this technique, we're hitting the lateral head of the tricep. It's the part of the tricep that attaches higher up on the arm bone. And again, experiment with different angles. Feels pretty nice. And then you can follow that down to the elbow. When you get lower down to the elbow, on the inside of the elbow, you're going to be getting more of the medial head of the tricep, the part of the tricep that attaches down the lower inside portion of the arm bone and fascially connects into the elbow flexors, as well as has connections going down out the pinky. And again, you're just kind of slowly moving around. Next up, you have a club bell or anything of this kind of shape that allows you to get into this area. Now, I'm going to be more on my side, kind of like this, same as the softball. I might have my elbow bent, place a hand on it. That's pretty nice. Next up is actually one of my favorites. Find the back of a chair and you can just rest your arm on the back of it. And what's nice is that it's usually, the backs of the chairs are usually thin enough that you can get very targeted, direct pressure. I will again highlight as you come down the arm to explore coming a little bit more to the inside. Now there are going to be nerves and arteries. If it doesn't feel right, just back off. However, there is going to be tissue in a lot of people that for example, rock climb, or just have a lot of tension coming through and are doing a lot of pull-ups, anything around that type of movement, the flexors will get tight and they can fastly connect actually into the tricep, which a lot of people don't realize, especially in this area. So just sink in and explore that area really slowly, but if it feels really intense but not zingy, then sink in, get that benefit. And don't be afraid, like you should go all the way down until you're basically hitting the elbow bone right here. Now, if you don't have a ball, you don't have a chair, here is the travel size version of the release, the kneecap. Sit on down, and there you go. You now have another ledge to drive pressure into the tricep, helping those tissues to release, relax, and hydrate. Lastly, there is a part of the tricep that attaches to the shoulder blade between two rotator cuff muscles, the infraspinatus and teres minor. But essentially, just take the ball, go a little bit behind the back of your delt, and just work in that area. If it feels productive, stay there. If it feels really tight and tender, you may need to go even further into this area of the traps and rhomboids, which we're not covering in this video. That's going to be episode 3, but check those out if this area feels really sensitive. As you get that to open up, that should allow you to get into this more. Also, just as with the deltoid and middle line, you can easily get the tricep in some good ways right here as well. It's time for the muscle you've all been waiting for. The biceps. If it wasn't for the bicep, would we have ever even invented a mirror? Who knows? To start off, we're going to get, again, a muscle and area that isn't the bicep, but starts on the trunk and goes into the bicep, which is the pec minor, pec area. So you're going to grab a ball, find the corner of a wall so that you're not having your face in a wall, and you're going to take the ball and lean into that wall. I'm just slowly searching, pressing into the wall, and sinking in. For me, I feel good just holding it here. So I would just hold it here for anywhere from 30 seconds to 2 minutes, maybe more, maybe less. And as it opens up, now again, it's kind of actually making, my body's telling me, I want to roll this way. But now we're starting to get into the areas that we're going to cover in video 3. But once you get this area to relax, you can start moving into the anterior, the front of the deltoid again, because that's actually where the bicep attaches. That's where you're going to get as much of the connective tissue of the bicep attachment as you can. You can then, of course, use a ball on the wall and just sink in. Now the bicep, which has 2 bellies, has 2 attachments in the lower arm. One is like right in here, which you can get on the wall. 2, the belly comes down into this connective tissue spread right here. And so a great way to get that is to come to this area that we've come to so many times before because it's such an important crossroads of tissue. And that is basically this meaty ball of tissue right here on the elbow. So you take a ball, get right here, and again, go to town, finding those areas. As that opens up, you'll come to the upper arm side of the bridge, and again, you can sink in, find those good spots. Now we're getting near the inside middle line, which, similar to the outside, is a thin line of connective tissue that connects the pec major, the big pec muscle, into all of the forearm flexors and finger flexors. And so the way that's going to work is you would just slowly come up, staying in this area right here. Now again, on where we are here, there's a lot of nerves and arteries. So if you feel a pulsating or any kind of nerve referral or zing, just back off. In this area, you can get the tricep, the inside of the tricep very well, and you can get brachialis, the mini bicep, pretty well, coming all the way up. All right, folks, that wraps up episode 2. Can't wait to see you in episode 3, where we go over the trunk, the big muscles of the pecs, lats, traps, to name a few, and I'll see you there.